Let's begin. We have a lot to share today. We have a lot of depression in America, but it's not due to a brain chemical imbalance, as you've been led to believe. There are legitimate reasons for feeling down or depressed. The end of relationships, the loss of a loved one, a pet, downsizing, loss of a job, fear of losing your home or losing your home, people acting out in ways that you would never hope they would, but they do, and ill health. Those are just some of the reasons. But the fact that you're depressed about something doesn't mean that you are forever depressed, doesn't mean you need medication for it. So we are an over-medicated society. In fact, 25% of all women between 25 and 45 are on some form of antidepressant or anti-anxiety medication. Is there another way? Yes, there is. I believe that we should see a return to humanistic psychoanalysis, psychotherapy, where you have a chance to speak with a person and explain what you feel maybe the causes of your maladies, who could have some experience opening up the picture, making it broader, giving you different ways of approaching it without medication or institutionalization. There's also nutrition. I did a PBS special years ago. It was called the Food-Mood Connection, showing the relationship between food and mood. And indeed, we can show how sugar can cause a person to become very depressed or very anxious, but also things that we're allergic to. I've counseled people who thought their children would be forever ADHD, but they were on a junk food diet high in caffeine and processed sugars, took them off the bad diet, put them on a clean, healthy, living foods diet. Suddenly the symptoms went away. We're talking about millions of people. But now there's one other piece to the puzzle. According to the latest research, it is chlorella. Chlorella, C-H-L-O-R-E-L-L-A. That is a seaweed. It is an algae. And according to the University of Western Australia in Perth, they have found that chlorella has significantly improved symptoms of depression. Researchers divided the individuals into two separate groups. They gave half the group 1,800 milligrams, that's 1.8 grams, of chlorella vulgaris every day, and the other they gave standard care. The researchers used the scale, what is called the Hospital Anxiety and Depression Scale, to test the patient's symptoms of depression, along with the Beck Depression Inventory 2 scale. Both of these have been used in clinical settings to establish the range of depressive symptoms and the severity of the diagnosis. After just 6 weeks of either using the standard pharmaceutical treatment or chlorella, the researchers found those patients who had taken the chlorella had, quote, significantly reduced scores in both depression tests. In fact, it went down almost 4 points, which is substantial. To give some reference, the HADS scale consists of 21 points, and anything over 8 is considered symptomatic of depression, and it went down below that. In addition to reduced test scores, the researchers also saw significant reductions in some of the subset scores. For example, physical and cognitive symptoms were significantly improved in the chlorella group, and that is substantial. Quote from the study: "This pilot exploratory trial provides the first clinical evidence on the efficacy and safety of adjunctive therapy with chlorella in improving physical and cognitive symptoms of depression as well as anxiety symptoms in patients who receive standard antidepressant therapy," end quote. So again, chlorella, C-H-L-O-R-E-L-L-A, is a microalgae. It is a single-celled algae. It's grown in tanks, so it's controlled for purity. It is really high in protein, over 40% protein, and it has all the 8 essential amino acids, and it stimulates growth hormone and brain neurotransmitters. And it's one of the great detoxification nutrients also. In fact, when helping people detoxify and cleanse and rebalance their biochemistry, I always recommend 2 microalgae, spirulina, which has even more protein, and chlorella together. And then add in some ginger juice. And if you take a teaspoon of chlorella, a teaspoon of spirulina, 2 ounces of ginger juice, 4 ounces of lemon juice, and you put all that into about 28 ounces of water, and you drink that throughout the day, you're doing your body a tremendous service. It also naturally chelates out and toxins. Now, we know that high blood sugar is bad. And we know that a lot of people wake up every morning, probably close to 100 million, known and pre-diabetics. And their blood sugars can be anywhere from 110 to 180. That's diabetic, and that's dangerous. That increases the likelihood of heart attack, stroke, breast cancer, depression, and neuropathies. So you kill yourself when your blood sugar's high. From the University of Delaware, quote, diabetes, which now affects 30 million Americans, can cause serious health complications, including heart disease, blindness, kidney failure, and low extremity amputations. Oh, by the way, as an aside, to the gentleman who came to the retreat with his wife, who showed me the cell phone of when he was in the hospital very recently, and with a huge opening on his foot, and they were recommending amputation. And he tried the protocol, and now his foot is healed, saved the foot. Would you please go back to the doctor, get the doctor to re-examine, show them the current foot, take a picture, the foot when you were in the hospital, and then ask the doctor how many amputations that hospital does for similar situations, and would he be interested in knowing the protocol that you used that saved your foot from being amputated? I'd like to see his response. In any case, the 30 million are diagnosed diabetics. There's 60 million who are undiagnosed. Now, what we know is this. A lesser known but equally grave complication of diabetes is bone health. Quote, clinical trials have revealed a startling elevation in fracture risk in diabetic patients. This according to Professor of Mechanical Engineering, University of Delaware, quote, bone fractures can be life-threatening. Nearly 1 in 6 hip fracture patient dies within a year of injury. And because physical exercise is proven to improve bone properties and reduce bone fractures in non-diabetic people, they wanted to see would this also be true for diabetes. And what they found was that high blood sugar inhibits the positive effects of exercise on bone health with diabetes. So, this is the takeaway message. Exercise every day. I suggest low-impact exercise if you're diabetic for a simple reason. You don't want to get a lesion. You don't want to get a blister because you may not feel it. When you have neuropathy, you frequently do not feel a little cut. You could puncture the skin. You wouldn't know it. Then in comes an infection. Because of poor circulation, swelling in the tissue, amputations are epidemic in our society. Absolutely epidemic. But if you begin exercising and gradually increase it up to an hour a day, start slow and graduate up in time and distance and duration, then you increase microcirculation. Now, if you take the tocotrienols, which are subfractions of the tocopherols, the vitamin E, and if you took 400 units before you exercised and 400 units after you exercised, and if you took vitamin C 1,000 milligrams buffered before you exercised and 1,000 milligrams after you exercised, if you took 200 units of milligrams of coenzyme Q10 before and 200 after, if you took magnesium 600 milligrams before and 600 milligrams after, and cayenne at a high heat index before and after, what you're doing, you're stimulating microcirculation into the extremities. You're helping your feet. You're also helping your brain, by the way. And you're lessening opportunity for stroke because you're keeping the blood thin and oxygenated. So if some of you want to know why, when you were exercising, thinking you were going to strengthen your bones and you didn't, it's because diabetes will weaken the bones, and exercise by itself will not be enough. And also, we have a very deadly bacteria. It's called Staph, S-T-A-P-H. According to Emory University, as published in PLOS ONE, this Staphylococcus aureus, is very virulent, and the pathogenesis makes it very difficult to treat. Quote, we've identified a family of compounds from this plant that have an interesting medical mechanism. Rather than killing staph, this botanical extract works by taking away staph's weapons, essentially shutting off the ability of the bacteria to create toxins that cause tissue damage. In other words, it takes the teeth out of the bacteria's bite. What exactly is this? It's causing 23,000 deaths a year, at least 2 million infections a year. What will stop it? Chestnut leaves. You heard me right. Chest, C-H-E-S-T, nut, N-U-T, leaves. You can get an extract of chestnut leaf extract from any health food store. So that's important to use. And that's from Emory University. And also, one last thing, low vitamin D is tied to dry eye syndrome. So if you have dry eyes, according to the International Journal of Rheumatic Diseases, could be due to vitamin D deficiency. A lot of people are not getting their vitamin D. Get your vitamin D. In Columbia University, a new study, depression definitely linked to refined carbohydrates. Quote, psychological health is deeply affected by physiological choices. One more reason to, quote, think before you eat. Could the bout of the blues you're dealing with be possibly linked to the pasta you had for last night's dinner? According to new research, absolutely. And while the importance of consuming wholesome, unprocessed foods has almost become common knowledge in recent years, the average American diet is still predominantly 70% made up of processed junk. And according to a recent study conducted by Columbia University and published in the American Journal of Clinical Nutrition, there is a, quote, clear link between consumption of refined carbohydrates and sugar and depression. The researchers stated, quote, any influence that refined carbohydrates has on mood could be commensurate, meaning corresponding to size or degree, with their proportion in the overall diet. So when you have your bagel, your donut, your toast, any of the white flour products, you are possibly contributing to depression. I'm Gary Null. That's our health segment for our program.